President Carlisle, I am honored to present to you for conferral of the 2014 Charles R. Drew University of Medicine and Science Honorary Doctoral Degree, Doctor of Humane Letters, Sylvia Drew Ivie.
Members of the Board of Trustees, the Board of Conciliars, Dr. Carlisle, members of the faculty and staff, graduates, family members, friends. Thank you, thank you, thank you for this wonderful honor. Congresswoman Hahn, it is such a pleasure to share this day with you. I remember so fondly being with your father here in 1981 when he and the postmaster unveiled a United States postage stamp with my father's image. Your father spoke about the importance of this university and about my father. I spoke about the need for more advocacy on behalf of the underserved. Afterwards, he said to me, "Why, you're a little politician yourself, aren't you?" I took that as a great compliment coming from someone who practiced the art of politics in the noblest sense and who was always such a powerful and persuasive advocate for this community. To the Drew University family, I say thank you for keeping the legacy of my father alive. You know the profile of his life: an athlete, a researcher in blood preservation, a teacher and trainer of stellar surgeons. He did so much in such a short 46-year life. How should we describe the essence of his legacy? To me, his special gift was the sustained and selfless investment he made in others. My mother always said Dad would give anyone the shirt off his back if he needed it. As a leader of athletes, researchers, surgeons, and as a father, he knew what was needed was not to give the shirt off his back. Rather, it was to impart his own unwavering belief in the capacity of every single person to rise to excellence by hard work and clean living. He shared that philosophy unstintingly in word and deed with others and by his own example. When his surgical residents would emerge from a conference with him, others would ask, "Did you get the elixir?" And they would always smile broadly and say, "Yes, yes, I did." When England asked him to send 5,000 units of dried plasma to Britain to aid the wounded in the war effort, he said, "There are not 5,000 units of plasma in the whole world, but help is on its way." And somehow he came through with more than enough to meet the urgent need. But unselfish investment in others requires more than good intentions, more than clear vision, and more than brilliant leadership. In order to endure, it requires structure. That's why the Red Cross created the blood bank. That's why Kenny Hahn worked so hard to get Martin Luther King built. We see that wisdom and skill exemplified today in the work of Supervisor Mark Ridley Thomas and the magnificent new buildings that he and the Board of Supervisors have built on this remarkable health campus. Mark has ingrained in all of us who work with him that there is no substitute for structure. It is one thing to have an idea. It is quite another thing to execute it and make it yield results. Drew University of Science is the structure that gives shape and permanence to a worthy vision. It is the embodiment of my father's belief in our shared capacity for excellence, excellence achieved through education, research, and clinical services in the context of community engagement. Because of you and your efforts, his values live on. Because of you, his legacy has an enduring home. I want to mention a few other people who have inspired my advocacy and my life. In the 1950s, I had a school friend who invited me to a dinner party at a fancy apartment in New York. Her father knew Eleanor Roosevelt, and indeed, Mrs. Roosevelt, probably the most famous and influential woman in the world, was there. I, of course, was young and shy, but when I was introduced to her, she peppered me with questions intent on knowing what I thought about this and that and why. I was stunned, not just by how wise she was, but how curious and how interested she was. To this day, I have never met a better listener. For Mrs. Roosevelt, people were never an abstraction. She understood the power of connecting with each human being she encountered, and I have never forgotten that. Eleanor Roosevelt said women enter the life of politics to make things better. Her first public act after her husband's election in 1932 was a tour of the Washington, D.C. alley slums, where hundreds lived without running water or sanitation facilities, just blocks from the U.S. Capitol. She immediately began a campaign to provide decent housing for all. She called for indoor plumbing and toilets in every home. How, someone opposed asked, how would anybody be able to tell the rich from the poor if Eleanor Roosevelt had her way? Her response was, in matters of simple dignity and decency, we should not be able to tell the rich from the poor. In 1939, Mrs. Roosevelt attended a meeting of the Southern Conference on Human Welfare in Birmingham, Alabama. Blacks on one side of the aisle, whites on the other. Mrs. Roosevelt placed her chair in the center of the aisle, between segregated sections, launching a silent protest considered shocking at the time against America's race etiquette. What I took from this example was you don't have to make a big noise to make a statement about injustice. For all of her efforts to make things better, Mrs. Roosevelt was frequently reviled. I am sorry, she said, that all these attacks against me are causing so much grief to my friends. But in these troubled times, I intend to go right on saying and doing what must be said and done. And I intend to provide lots of ammunition for attack in the future. Another source of inspiration for me was the physician and anatomy professor at Howard University Medical School, Dr. Montague Cobb. I worked for Dr. Cobb when he was the editor of the National Medical Association Journal. It was Dr. Cobb who first tied medicine and political advocacy together in my mind. It was Dr. Cobb's strident advocacy to open opportunities of medical education for men and women of color that helped me understand the barriers to care of minority people. If you could not get into medical school because of your color, if you could not get privileges at a hospital for the same reasons, the patients could not get care. It was Dr. Cobb who announced to me on one hot August day in 1963, "Sylvia, we are going to the March on Washington." "We are?" I said. "Yes, we are, and it will be a great day." We sat right down front and swayed with the 200,000 people behind us, singing "We Shall Overcome." He introduced me to Martin Luther King. Naming the School of Medicine here for Dr. Cobb is such a fitting tribute. This school is, by its very existence, a tremendous political statement. I have worked with so many wonderful true believers in the Drew mission and vision over the years. Mitchell Spellman, Leroy Weeks, David Satcher, Patrick Dowling, Al Haynes, Lillian Mobley, Gus Gill, Gail Oram, David Martins, Keith Norris, Ron Edelstein, the list goes on. And now your new president, David Carlisle, has made me feel so at home whenever I have been on campus. Being among you must, in an unconscious way, remind me of my youth growing up on the Howard University campus, running in and out of my father's office at Freedman's Hospital, ducking into the cafeteria of the girls' dormitory at Howard any chance I got for a slice of apple pie. My, that pie was good. There was a family feeling about the Howard campus. There is a similar family feeling about Drew University for me. Families stick together through thick and thin. Families believe in one another regardless of the doubts of the outside world. Families know the special gifts of each of its members, whether the world recognizes them or not. Drew University partners, we are ascending. Keep with us. We need you now more than ever. So graduates, faculty members, I say thank you for this formal induction into the Drew University family. I've believed in you all along, and I know you will continue to make us all proud. As you move beyond the celebration today, remember the words of Winston Churchill. Success is not final. Failure is not fatal. It is the courage that continue that matters. Thank you very much.